Yeah.
Very good afternoon to all the faculties and media friends. Today we are going to see a very interesting topic that is cerebral circulation. So the synopsis for today's class are: what is cerebral circulation, cerebral metabolism, special features of cerebral circulation, innervation of cerebral vessels, normal value and measurement of cerebral blood flow, regulation of CBF, and applied aspects. So first of all, what do we mean by cerebral circulation? Cerebral circulation is the blood supply to the brain through blood vessels, which ensures the oxygen supply to the brain and removal of the waste products. So coming to cerebral metabolism, brain tissue is very highly sensitive to hypoxia. Stoppage of blood supply for more than 5 minutes to the brain will lead to very irreparable damage and can lead to coma. Brain utilizes glucose as the main fuel. Prolonged hypoglycemia leads to cerebral dysfunction. Metabolic requirements of the brain remain fairly constant irrespective of the activities of the brain tissue. Utilization of the glucose by the brain is independent of its rate. So this is a very peculiar character of brain tissue. So coming to special features of cerebral circulation. Cerebral arteries are end arteries. Intracranial contents are incompressible. Capillaries present in brain are non-fenestrated. The meaning of non-fenestrated is that they have holes in their endothelial cells. Blood-brain barrier provides protection to the brain from toxic and harmful substances circulating in the blood. Tight junctions are present between the endothelial cells and have a thick base in the brain. So this is a very unique feature of the blood-brain barrier. Coming to the blood supply of the brain, here you can see that the two vertebral arteries joins to form the basilar artery. The basilar artery along with the common carotid artery form the circle of Willis. The circle of Willis gives rise to three pairs of the important vessels which supply the blood to the brain. They are the anterior cerebral artery, middle cerebral artery, and the posterior cerebral artery. So at the point of time, you have to remember that the circle of Willis plays a very important role in blood supply to the brain tissue. This is just a representation how the blood-brain barrier is formed. Here you can find the pericyte, astrocyte, the peak of the astrocytes, how it is formed in the brain tissue is just a representation. Coming to the innervation of cerebral vessels, we are going to talk about sympathetic and parasympathetic supply. In sympathetic supply, release of norepinephrine at their nerve endings. Vasoconstrictive effect of sympathetic stimulation on this is very less marked compared to parasympathetic effect. Stimulation of parasympathetic fibers results in vasodilation. These fibers secrete acetylcholine. Here you have to note that the cerebral blood vessels are highly sensitive to pain. But interestingly, the brain tissue is not sensitive to pain because it does not receive the pain fibers. So coming to measurement of cerebral blood flow. Here there are many methods. We are going to focus on kidney split method, which is an important method. This method uses fixed principle. Here the patient is exposed to or inhaled by the nitrous oxide for 10 minutes. The arterial and venous sample are collected and the atriovenous difference is measured. And finally the cerebral blood flow is measured by using the formula amount of nitrous oxide taken by the brain by the atriovenous difference of nitrous oxide across the brain. Normal CBF value is 750 ml per minute. This is about 14% of the total cardiac output. Coming to the regulation of cerebral blood flow, here we have to remember about a very important topic that is called as Monroe-Kelly topic. This says that at any given time, the total volume of blood, the CSF volume, that is cerebrospinal fluid volume, and the brain tissue in the cranial cavity remains constant. That is, the change in one component is associated with opposite alteration in the other component. Suppose, due to tumor, the brain tissue may increase in size. That is, it may cause a decremental response in the other two components. Coming to the role of intracranial pressure. The rise in intracranial pressure will compress the cerebral arteries. Increase in intracranial pressure during straining helps in protecting the cerebral vessels. Metabolic regulation. The cerebral blood flow is altered by production of local vasodilators. So some of the local vasodilators are potassium, hydrogen, and adenosine. Here, a fall in the partial pressure of carbon dioxide during hyperventilation results in cerebral vasoconstriction. Coming to applied aspect, here we are going to talk about two main points. That is, first one is stroke. Stroke is of two types when point of brain. ischemic stroke and hemorrhagic stroke. In ischemic stroke, due to blockage of cerebral artery by thromboembolism. In hemorrhagic stroke, it is caused by bleeding directly into brain tissue, which may be due to rupture of cerebral arteries. The treatment for this is intravascular thrombolysis and excitotoxic drugs. So next applied aspect is blood-brain barrier breakdown. So when any inflammation or tumor comes to the brain, the blood-brain barrier, which is normally present, leads to breakage. Here you can see that the microglia, astrocyte and neuron pericyte, basal membrane and tight junctions are in normal condition. But here the tight junctions are broken, and here you can see the monocyte, activated microglia and detached swollen astrocyte. Here the demyelination and neuronal damage also takes place. So thank you all for giving this wonderful opportunity.